Well, now Entertainment Tonight's Plastic Surgery Week examines the woman who looks just like a real-life Barbie. Her appearance really is startling. So what is the secret behind her transformation? Did she go under the knife to look exactly like the doll, or can someone really be born looking just like Barbie?
We asked Beverly Hills plastic surgeon Dr. Huang-Begovic what she suspects Valeria may also have had done to her body.
I mean, looking at these photos, I mean, she definitely does look like a Barbie. She looks, you know, pretty artificial and a little bit overdone. She could have had some liposuction to make her waist thinner. She has very, very refined features in her face, so she could have had rhinoplasty to narrow her nose, filler to make her lips look bigger and poutier, and maybe some Botox to sort of give her that overall smooth look.
Today we're asking the question, should you switch up your health choices? Our next guest is a woman who decided to switch out her doctor to correct her less than perfect plastic surgery.
Exercise alone has not given me the results on my body shape that I've wanted. So I said, well, I'm gonna just go ahead and try the liposuction. It wasn't for any weight loss. It was wanting to have more of a feminine waistline, have a flatter stomach. After the liposuction, I was not as satisfied as I was hoping to be. I could see a ridge on my abdomen area, some contouring waviness around my abdomen. I have some incision scars right in the middle of my back. About a year after the procedure, the physician told me there was really nothing more that he could do. So I lived with the dissatisfaction every day, trying to hide it with slimming garments. Dr. Begovic specializes in micro body contouring.
Dawn is actually a perfect candidate for this type of procedure. Okay, Dawn, so I'm gonna start removing the fat from your lower abdomen, that little shelf you have, okay? My goal is to even it out as much as possible to correct some of the areas on the abdomen where more fat was taken than others. She does have a lot of scar tissue, but as you can see, there is fat that's coming out in a nice, even fashion. This will give her a much more hourglass figure.
I'm definitely looking forward to the after, when it's looking good and feeling good.
Joining us now is Dawn and her new plastic surgeon, Dr. Huang-Begovic. Nice to have you.
Thank you.
Welcome. Doctor, good to see you. Dawn, welcome.
Hi, thank you.
So obviously in this scenario, you were dissatisfied and you changed things around a little bit. We saw in the video and you're very happy with your results.
I'm very pleased, yeah. So you'll see from the after pictures.
Let's take a look at those. Let's take a look at your befores and your afters. And Dr. Begovic, take us through. It looks like you removed fat that wasn't removed and smooth things out.
Right. You know, basically, you know, it just took a lot of surgical planning and mapping out. So we use the latest technology, which is the body jet, which uses water. And so sort of with that technology, it made it easy to blend in some of the different pockets of fat. And I mean, there's actually more pictures where you can't even see, but her back, her waistline is just very hourglass, whereas before it was sort of up and down.
A very, very nice result. And, you know, I think the take home is do your homework before going into any elective plastic surgery, but understand that revisions are sometimes necessary and
they're challenging, you know, and the main thing, like, as you know, is, you know, just making sure that a patient has realistic expectations, because, you know, I told Dawn, I said, it's going to be really hard. There's going to be a lot of scar tissue. You know, I told her I'd do everything that I could to really, you know, make it as best as I could, but we went in and everything worked out, and she looks fabulous.
You look great.
Amazing.
Dr. Begovic, thank you so much, Dawn. Thank you for sharing the story with us.
Thank you.
Hi, this is Dr. Huang-Begovic for the Beauty TV Minute. Teresa, a 24-year-old from Los Angeles, California, asks, I heard silicone implants are being used again. Weren't they banned? Well, in November of 2006, the FDA approved Allergan and Mentor silicone gel-filled breast implants to be used for breast augmentation. The FDA's decision to approve these implants was based on a thorough review of each company's clinical studies and research performed by independent scientists. In addition, the FDA conducted inspections of each company's manufacturing facilities. Over the last 10 years, many independent studies have concluded that there is no evidence that breast implants are associated with connective tissue disorders or cancer. However, the current studies are on women followed for only 3 to 4 years after their implants, and they are currently collecting data on patients with longer follow-up. Silicone implants are natural feeling and give women a wonderful cosmetic result. My patients are often amazed at how real their breasts look and feel.
Well, I've been jabbering over here, and I'm here with my assistant today, Dr. Huang-Begovic, plastic surgeon who works with me in Beverly Hills. She's been nice enough to actually be the vampire-esque. She drew the blood.
And you have over there, Dr. Kat, the blood product centrifuged. Yeah. It's cool how it separates out, those layers.
I'm just below the skin. This is an intradermal injection, just like you would do with other fillers. There you go. Thanks. Dr. Kat.
Hi, this is Dr. Huang-Begovic for the Beauty TV Minute. Barbara, a 42-year-old mother of 3 from San Francisco, asks, after my children, I've noticed some extra tissue in my labia. I've been unable to do yoga and ride my bike because I feel embarrassed wearing tight clothing and also have discomfort. I've heard there's a surgery for this. Yes, Barbara, there is. In fact, I just finished writing a chapter about vaginal cosmetic surgery in the International Textbook of Aesthetic Surgery. The surgery essentially trims excessive tissue, resulting in an improved cosmetic appearance, as well as relieving discomfort from the excessive tissue rubbing on clothing. It is an outpatient surgery. You can usually go back to work in about 4 to 5 days, but you will have to wait 6 weeks before sexual intercourse. And complete healing, like most surgeries, is about 3 months.
There's a new trend that's really taking off. Botox for men, often referred to as Brotox. More men than ever are now getting the injections to help them look young, keep them more competitive in the workplace. Gina Silva has a story.
Wrinkles. Apparently, some men hate them just as much as women. So they're turning to a well-known wrinkle buster.
For me, this is just another sort of tool in the tool belt.
And that tool for Patrick Orr is Botox.
For him, we're using just a small amount around the eyes, about 12 units total. So that way I'll give him a very subtle result where I'll take a little bit of the edge off.
Some guys call it Brotox, and it is growing in popularity. In fact, last year, more than 385,000 men got the injections, according to the American Society of Plastic Surgeons.
I think that men want to look good just like women do.
Dr. Huang-Begovic says her practice has seen a steady increase in men wanting Botox. Patrick sort of falls into that category. He's an actor and wants to keep his youthful good looks.
Today I'm just getting it just really simple right around the eyes, just the crow's feet. And the plan is for the wrinkles not to go away, but just to sort of lessen slightly.
David Leonti, who has been getting Botox for the last 5 years.
It's not just for the ladies anymore now.
Says there's nothing wrong with men seeking a little beauty assistance.
I'm hoping to prolong the younger appearance for as long as possible. We know it's not physically, humanly possible to last forever, but prolonging it would definitely be a bonus.
Perfect.
Gina Silva, Fox 11 News.
Live from the CBS Broadcast Center in Los Angeles, this is CBS 2 News at 5 p.m. Coverage you can count on.
Well, everywhere you look, it seems some star is showing off their derriere, and that has some women worrying their assets aren't measuring up. CBS 2's Christine Lazar shows us how the quest for a bigger behind is becoming big business.
A few years ago, it was about having like breast enhancements, and that was the big thing. And now it's your tush.
Look at her butt. Rap stars have been praising the derriere for decades, but businesses have only recently begun to cash in.
The thigh gap was such a big conversation about a year ago, but now it's shifted around to the back.
Kitson in West Hollywood sells this underwear.
Kind of gives you a lift and a little bit rounder rear end.
The makers of Booty Pop say sales are up nearly 50% from this time last year, and there are plans to make a new product with even more padding. Women seeking rounder rumps are also taking more extreme measures to alter their appearance. But enhancing plastic surgery is up more than 50% in the U.S.
It's called Brazilian butt lift, and what that involves is doing liposuction in various areas of the body, usually the abdomen and the waist. and then transferring the fat to the butt area.
Beverly Hills plastic surgeon Dr. Huang-Begovic says the procedure costs between $10,000 and $20,000. In Beverly Hills, Christine Lazar, CBS 2 News.